Scotland's now a multicultural society with 150 languages in use every day in this country. In the last few years, there have been requests for interpreters who can speak more than 30 different languages, the most popular being Polish, Lithuanian, Chinese, Arabic and Urdu. Well, the aim of this short video is to give you an introduction to the range of professional translation services available in NHS Forth Valley.
There's a risk of poorer outcomes where there is a language barrier. There's also evidence that shows that people are less likely to present for the type of care that keeps them well. If they do go to hospital via A&E, that they're less likely to receive appropriate follow-on treatment.
Good morning, can I help you?
Hello.
It's important to find out what language the patient speaks. A multilingual phrasebook is currently in use to assist with emergency and hospital care. The resource provides a small range of standard letters and leaflets in use in primary care and signposts a small range of reliable web-based resources such as those provided by Health Scotland.
Please can you put me through to a Cantonese, Chinese interpreter, please?
A number of scenarios may exist where interpreting or translation help is required, and an interpreter can be booked to be present during a consultation with a patient.
A professional interpreter are trained to observe confidentiality. They are supposed to be impartial, they're neutral and independent. They are there to interpret for both parties, and sometimes that's a common misconception.
This type of service is particularly important when it's a patient's first visit, delivering bad news, or if an individual is frightened or upset. It's also suitable for mental health consultations, any sight translation where an English language document needs to be read to the patient, or for a consultation with a child.
Having an interpreter is fairly crucial in my line of work, just to try and build up a rapport with the patients that we see. They're often in a state of some distress and emotional turmoil, and it's important to be able to communicate with them in a way which they're comfortable with and which they can understand.
As well as face-to-face services, an interpreter can be arranged to be on conference call with the patient and their consultant. This type of service can be useful for a number of reasons. For example, when the content to be discussed is relatively simple, for finding out which language a patient speaks in an emergency situation, or when you're in a rural or remote location and can't get an interpreter on site, or if privacy is an issue. Calls can also be made directly to the patient from an arranged call, and this can be useful to confirm or convey simple messages.
Using an interpreter effectively doesn't just help the service user, it also helps the staff as well. You're then confident that the information that you've actually given across has been given across accurately. You're confident as well that the patient can ask you questions when you're there.
Healthcare staff and our contractors are required under equalities legislation to make their services accessible to everybody, whether or not they have a language barrier. So that's why it's really important that staff and contractors are really confident about what services are in place and how to access and use those services appropriately.
So no matter the situation or the language involved, there is always a way of communicating effectively and accurately with people. This help brings down barriers and gives reassurance to both patients and staff, and ultimately provides the best healthcare possible to those who need it. Scotland's deaf-blind community can often face problems communicating with others and absorbing information. So to help Scots with visual and audio impairments, NHS Forth Valley has brought in a number of interpreters who will guide them through the healthcare process. Interpreters are on hand to discuss a variety of issues and can typically be involved in a three-way meeting with the client and the health worker or practitioner.
Different communication supports available throughout the NHS. The important thing would be to ask the person themselves what mode of communication they prefer and be guided by them.
The services provided include British Sign Language, sign-supported English, electronic note takers, lip speakers and deaf-blind guide communication. Each year, NHS Forth Valley will deal with nearly 1,000 appointments in which interpreting support will be required. There are, of course, seasonal fluctuations in demand for these services with an increase in usage over the winter months. Let's now hear about some of the languages used by people with sensory impairment.
We in the deaf community use BSL. What is BSL? It stands for British Sign Language. It has its own grammar, and also it uses facial expressions. It doesn't follow an English word format. However, some deaf people may prefer to use SSE, which is Sign Supported English. What that does, it borrows some signs from BSL, but it uses them in an English format. You could have an interpreter who would use the block manual for someone, whereby they would trace the letters on someone's palm in block capitals and they can follow it. Or you have a hands-on mode of communication whereby the actual interpreter would sit opposite the person and they would make movements with their hands and the person can follow it. Or you would have a deaf-blind manual whereby the letters are actually produced on the palm of the hand but not in writing.
It's important that every patient who walks through the doors of NHS Forth Valley is treated like an equal, no matter their needs or disabilities. Translators are now an essential part of the healthcare team. They provide an important service to those whom society can sometimes isolate and ignore. NHS Forth Valley is bringing down barriers between patients and staff and giving the best treatment to anyone who needs it.